Hello, everyone. Welcome to today's live stream. Good of you to join me. Welcome to Askawayhealth Live. I'm Dr. Sylvia, your hostess, a general practitioner, health educator with Askawayhealth. If this is your first time joining, I'm pleased to have you here this afternoon. Thanks for choosing to spend some part of your Sunday with me. On our channel, we have videos discussing trending medical, health, wellness, and lifestyle topics to help us get the best out of life. We publish a new video every Thursday evening, and our Sunday live streams are just a chance to get in a quick 15-20 minute chat on common health questions that I come across. So I hope you can make it a date when you can. You can find us on social media on Askawayhealth, so Instagram, Twitter, Facebook, and our website is askawayhealth.org, and of course here in the YouTube channel. So make sure you find a way to connect with us on social, subscribe to our channel. You find all the links in the description box. So if you haven't done so already, please make sure you do. I'm a general practitioner. I'm a member of the Royal College of General Practitioners in the United Kingdom. Been practicing medicine for 20 years going on. And I have special interest in topics like sexual and reproductive health and mental health, amongst other things. And of course, I'm a YouTuber. So have a look in the description box after the video to learn more about what I do, the things that keep me busy. Today, we're going to be talking a little bit about side effects of blood pressure, high blood pressure treatment, drugs in particular. But before I start that discussion, I just wanted to take a few minutes to share with you. It's a sad time for my medical community at the moment. We lost one of our colleagues, a clinical pathologist, Dr. Tope Oshodi of the College of Medicine of the University of Lagos in Nigeria yesterday morning. A lovely, lovely gentleman. And just wanted to take just a couple of seconds to express deep, deep condolences to the family and friends. His wife is also a colleague, a doctor who I attended medical school with, and a very close friend. So we're all really, really, really quite sad by what's happened, and just offer the family comfort and just remember them at this time. So this is one of the things that happens in life. So if you're just joining in, welcome. I'll have a look at the chat in a minute, but I'll just get started on the topic, give us a bit of background. We've been talking about high blood pressure for a second week now. We had a live stream on Sunday last week where I talked about issues around high blood pressure. And just a quick reminder, of course, your blood pressure is the vital life-sustaining force that helps to pump blood all around your body. And of course, without blood pressure, it's impossible to sustain life. So it's really something that's quite relevant, because high blood pressure is a very common problem. Yes, it's more common in older people generally, and it is true that above the age of 45 or thereabouts, it tends to affect men more than women. But by the age of 65, you actually get a reversal, and more women appear to be affected with high blood pressure. And that's important because we don't tend to consider very much heart disease in women. It's another topic, a topic for another day altogether, but it's really important to say that heart disease in women is quite significant. So remember that high blood pressure can happen in larger, more significant degree, to a more significant degree in women by the age of 65 and older. Having a close family member with high blood pressure puts you at risk. So please be aware of this. If anyone, a parent, other relative, has high blood pressure, it increases your risk of developing it. And Africans are at high risk of developing high blood pressure. It's also a great relationship, when I say great, or a significant relationship between diabetes and high blood pressure. So people who have diabetes do have a greater risk of high blood pressure than those who do not have diabetes. Now, with all this saying that high blood pressure is common in older people, incredibly, it is happening in people under the age of 45. So we're getting people under that age group coming with very high blood pressure who need treatment. And let's not forget that it can cause serious problems like kidney disease, heart disease. Please have a look at our live stream from last week where we really went into detail about this. Of course, the links will be in the description box for you as well. Now, high blood pressure generally does not show symptoms. Or I guess the better way to put it is more often there are no symptoms. But when the symptoms do happen, there could be problems like very bad or severe headaches, feeling extremely tired, having problems with your eyesight out of the blue, and problems start developing with vision. There could be chest pain, difficulty breathing, or palpitations and irregular heartbeat. So although many times, or most of the time, there are no symptoms with high blood pressure, and people only find out that their blood pressure is high when they go off to check something else. For example, they go to see the doctor for something else. And one of the routine vital tests that we will check is your blood pressure, the way we check your pulse and your temperature. And then some people just are told, oh, your blood pressure is high, did you know? And that's what sets it off. Over a couple more readings, the blood pressure remains high, and that's it. They didn't realize there were no symptoms. So it's important to know that, but also to realize that sometimes there can be symptoms. To treat high blood pressure, we use a combination of non-drug treatment, lifestyle changes, and medication. So it is true that lifestyle changes like losing weight, a healthy lifestyle, getting in regular exercise, regular eating, cutting down things like alcohol, cutting away salt, stop smoking, and cutting away things like caffeine can help to reduce blood pressure. So just making those little changes can contribute to that. But for some people, that's not enough. You do need to use medication in addition to that to monitor to get the blood pressure, to reduce the blood pressure. So let's just have a quick look in the chat. Say hello to everybody here. Hello, hi there. Oh, so nice to see you, Neka. Very, very good to have you here this afternoon. Yes, thank you so much. We're just getting to grips with the loss, and indeed, may his soul rest in peace. Absolutely. Hello, Dental Storm. Nice to have you in this afternoon. Thank you so much. I appreciate your thoughts. Thank you so much, everyone. Hello, Mr. Philip. I'd already said to you before the stream started. So welcome everybody else. Good to have you on here. So let's move on. Just briefly about blood pressure drugs. There are lots of them. If you are somebody who has high blood pressure, or you know somebody who has high blood pressure, then you probably know that there are quite a few different types of blood pressure medicines. And I'm just going to quickly go through them so we don't spend too much time on that. You can spend hours on the subject. We're not going to do that. So one of the groups of blood pressure drugs that we have are called diuretics. These are also known as water tablets, because the way they work is by reducing the amount of salt, sodium and fluid levels in your body to reduce the blood pressure. So they get rid of salt and water from the body, and that's how they lower the blood pressure. They're called diuretics or water tablets. Another group is known as beta blockers. Now, beta blockers are tablets that block the sympathetic nervous system. That's the part of our nervous system that's responsible for the way our different organs work, like the heart and our blood vessels. So the beta blockers block the effect of the sympathetic nervous system, which normally would make the heart contract and make the blood vessels squeeze to push blood through, or the muscles of the blood vessels contract. And by the blocking effect of those medicines, they reduce the force, the workload of the heart, and the blood vessels, which helps lower the blood pressure. So that's another category of blood pressure tablets that works on the sympathetic nervous system. Another group works on called ACE inhibitors or angiotensin blockers, and blockers also works by blocking a chemical which normally would narrow the blood vessels. So the blood vessels are important because remember at the beginning we said that they are responsible for the blood flow, the force of the blood pressure going through your body. So when blood pressure is high, the force with which the blood is flowing through is so high, too high for the heart to tolerate. And the effect of that over time can contribute to damage to the muscles of the heart. So what the drugs like the ACE inhibitors and the angiotensinogen blockers do is to reduce or prevent the effect of the chemicals which work in the blood to narrow the blood vessels or contract their muscles. So I don't want to make it too complicated, but basically they will make those blood vessels relax. And when they relax, it lowers the blood pressure. So that's another group of blood pressure medications. And you have the calcium channel blockers. That's another group of blood pressure medicines. And what they do is they prevent calcium getting into the cells. When calcium gets into the cells of the heart, it increases the heart's contraction. And so what you're trying to do in treating blood pressure is to relax these activities of this contraction, tightening activities of the heart and the blood vessels in order to reduce or relax the vessels and help to reduce the blood pressure. So different categories of blood pressure medicines like the diuretics, the beta blockers, the ACE inhibitors and the ARB drugs, the calcium channel blockers. You also have some other types of blood pressure medicines that work in different ways, alpha blockers and vasodilators. So not to confuse us with all these names, the reason I've gone into this is just to explain that there's so many different types of blood pressure medicines out there, and they can contribute towards different types of side effects, which is where we're going today. What we're talking about today is possible side effects that can happen with the blood pressure medication. So let's just carry on and have a quick look. Bear with me. Yeah, okay. So, fantastic. So, what are medicine side effects? A side effect, as we know, is any unintended outcome of a drug, an event that is not the reason that you're taking the medicine. So you take a medicine to treat your headache, and all of a sudden you come out in a rash. So that's an unintended side effect or unintended effect, or what we commonly refer to as a side effect. Now, it can happen, it depends on how the drug works. But we should know that even if a drug is just supposed to work on your heart, it can have effects on other parts of the body. And so that's why blood pressure drugs can have effects, so many different types of effects. But generally across the board, different medicines can potentially have an effect on the different systems of the body. So the skin or the hair, the brain, the blood, kidneys, and so on. The method or the way that the drug is given or administered also determines the particular side effect. So certain drugs applied as creams can cause irritation to the skin, or drugs given as eye drops can cause irritation in the eye, blur the eyesight, or there might be vomiting or nausea because of medicines that are given by mouth or are taken by mouth. I think an important message I would love to emphasize is that us as health workers should absolutely discuss side effects with our patients and make it as routine. I know it can be very busy sometimes during consultation, but it's such a key aspect of the treatment because it can determine whether or not our patients will stay on the medicine, will understand and stay on the medicine or come back to us if there are any problems with taking medicine. On the other hand, it's also important for people who are taking the medicine to ask, to be proactive and say, what can I expect from this medicine in terms of the goal? What's the treatment goal? And are there any adverse effects that might happen that I should expect? So this kind of interaction should become a routine part of our consultation process. Now, the common side effects, obviously common, they happen every time or most of the time when the medicine is taken. They can happen the first time you have the tablet or the medicine, or they build up as you start taking them. So they could develop within a few hours or days, or it could be over weeks or months. And that's how side effects might happen. They can be mild, moderate, or severe. And commonly, as the term implies, they would happen to a lot of people taking that same drug might experience the side effects. So that's what we mean by common, which is different from the rare side effect of the drug, which you would expect. A majority of those people taking the medicine may not end up with those side effects, but they could happen. So people should be aware, and so we know what to do if they do happen. There's no way I can go into the different side effects of all the different antihypertensive drugs. There's so many of them. We talked about 5 categories. There are actually more than 5 categories. And in each category, you have several different drugs within them. So each one has its own side effect. But the common side effects you might experience with the blood pressure drugs, things like nausea, feeling sick and vomiting, problems like diarrhea, pain, so problems affecting the bowels and the stomach. Some of them could cause constipation. Leaving that system, you could get things like dizziness or vertigo, headache, very low blood pressure, feeling very weak and tired. That's one of the side effects that could develop from taking these medicines. And some of them could cause sleeplessness. They could affect the kidney organs seriously. For example, kidney injury, change the levels or the balance of salt in our system, cause problems like hyperkalemia, which is high potassium levels. Some of them can affect the lungs as well, or the respiratory tissues, and cause cough, a dry cough, or breathing problems. They can affect the heart itself. Remember that I talked about the beta blockers, which I said they block the effect of the sympathetic nervous system. Well, by those tablets, when they're taken in some people, can actually slow the heart down so much, so the heart rate goes down. Now, that's not the effect you want is to slow the heart rate and to lower the blood pressure, but not excessively. So when it happens excessively, that is a side effect, and it comes from the way the medication works. Other problems that can happen are going to toilet to pass urine frequently. We talked about water tablets, diuretics. The side effect of that is that somebody goes to toilet quite frequently. And some of the tablets can also cause people's blood sugar to go up. Another condition that can happen is called erectile dysfunction, when men have problems achieving erections. And that can be quite common for some blood pressure medicines. In other blood pressure medicines, it can be rare, but there are quite a number, 1 or 2, where this is a common side effect. Things like leg swelling. There's some blood pressure tablets that cause swollen feet and ankles. They might affect the muscles, cause aching in the muscles and joints. And of course, don't leave out the skin. Skin rashes, flushing to the skin, different skin reactions, sometimes dry mouth, cold hands and feet. So this is an array of possible common side effects that people could develop. And you can just imagine, as a prescriber, if you don't explain to the patient, that you might have this side effect, and then they go home and start taking this, of course, it can put people off. And of course, on the side of the person taking the tablet, if you weren't warned or advised that this might happen, it's obviously a bit of a shock to you, and you sort of, oh gosh, what do I do with these tablets? And then just a quick word about the rare drug side effects of the blood pressure medicines. Another gamut of different effects there. Of course, it can reduce the appetite and upset the bowels and the stomach. So that's a feature as well. Not as common in many of the drugs, but it can happen. Some people can faint. Remember, we talked about dizziness. feeling of dizziness and the person is a bit lightheaded is quite common, but actually losing consciousness and fainting is one of the rare side effects of some of these drugs. Some of them can affect the mood and cause depression. They can cause severe injury to organs like the liver, cause hepatitis or pancreatitis. We talked about how they can affect the muscles and the joints. A lot of the time, it's a common side effect, but some can be quite severe, and it happens on rare occasions with some of these medications as well. Severe skin reaction, there's a condition called Steven-Johnson syndrome, where there is a very severe inflammatory effect of the skin, almost sloughing off of the top layer of the skin, can be very uncomfortable, and that can be caused by some of these medicines. People might develop excessive sweating problems. And one other thing that can happen, rare, but can happen with some of the blood pressure medicines, is changing the blood cells. So people develop anemia because they have low red blood cell count, or people developing low white cell count, so they can't even fight off infections, or developing low platelets, so their blood can't clot, simply because they're taking blood pressure medication. So not saying this to put anybody off, but saying this because it is important as a person taking blood pressure medicine to please have a look at your leaflet. If you're prescribed any medicine, have a look at the information leaflet that comes with the medicine and familiarize yourself. What could you expect with this medicine? So hello let me just have a look at the chat again. Hello, David. Welcome. Oh, welcome, Helen from New Wine Platter. And hi, Dr. Abdul. Really good to have you here. Thank you so much. And Dental Storm is saying it's important to enlighten patients about these side effects. When they notice it, they should be reported. Absolutely. Absolutely. Yeah, I totally agree. I think one of the things that we should do for our patients is, apart from writing the prescription and giving them the medication to go away with, is tell them what to expect and encourage them to come back. And you've really, Dental Storm, you really had a good point. It should be reported so that we know that this is going on, so that we know what to do. So I'm going to start rounding up in a few minutes, but I wanted to tackle two questions about side effects. If side effects happen, what should you do as a person taking these blood pressure medicines? When should you contact your doctor? So we doctors, we tell our patients, please don't stop taking your medicine, because we're trying to make sure there's continuity. And the reason for that, I heard a cardiologist, a heart specialist, talking about this. He said, people talk about blood pressure and we get really worried and bothered if it's very high, 200 over 120, 220 over 110. And it's right to be concerned, absolutely, because such high numbers can be linked to things like a heart attack or stroke. But he said there seems to be less tension over blood pressure that's still high, but not as high as those numbers I've just mentioned. So 150 over 90, 160 over 85, 165 over 100, or 165 over 90. Those blood pressure, people may just think, okay, it's a little bit high, it's not dangerously high. But these pressures, those levels, if left unchecked, contribute to serious complications over time. So the reason you're taking these medicines is to particularly tackle the long-term effects, because if you leave the blood pressure unchecked for months and years, then that's what contributes to kidney damage and heart damage that could lead to heart failure later on in life, or lead to problems with eyesight and blindness later on in life, or lead to kidney problems that people might need to have dialysis or things later on in life. So it's really important if you're taking your medicines, you're taking it every single day because you want to control your blood pressure over time. That is as important as making sure it doesn't get so high that we're admitting you in as an emergency because we don't want you to develop a stroke. So I thought when the cardiologist made that point, we just take it for granted, but it's really important. So we tell our patients, don't stop taking the medication, but if you develop a side effect, first, if it's a severe condition, for example, I talked about the medications like the beta blockers or drugs that could, things like the angiotensin receptor blockers. These drugs, taking them could result in side effects like a very low pulse or heart rate, or very fast heart rate. Some of the other drugs might cause breathing problems, so difficulty to catch the breath, breathing very fast. These are emergency situations, or a very severe skin rash, really bad inflammation happens very, very quickly. That needs urgent medical attention and urgent contact with the doctor. Call an ambulance or get to the hospital, get someone to take you to the hospital as soon as possible. That needs immediate attention. If possible, take along with you the blood pressure treatment that you're having, in case you're seeing a doctor who is not your usual specialist, and any other medicines that you might be taking, so that we know what it is that has created this response and how to best treat it. On the other hand, if it's a mild or moderate condition that develops, speak to your doctor. Just as Dental Storm said, report it. Report the condition so that your doctor, number one, we document it on your file, and nobody's going to give that to you ever again, because we don't want any unwanted effects or untoward effects. It's documented on your file, and then we think of what to do, because the challenge now is we need to maintain your blood pressure treatment. At the same time, we don't want undesired side effects. And there are things that we can do. We can alter the dose of your medication, because side effects tend to happen. The side effects tend to happen more severely the higher the dose. So it might be that you're on a dose of the medicine that is just too high, and lowering it, reducing the dose, might achieve the control of the blood pressure while keeping you happy, which is a win-win for everybody. So it's important to talk to your doctor. They might change the tablet. That's another option. So it's not a situation where you develop a side effect and think, oh, I can never have this tablet, it's over, nothing, and then ignore the blood pressure. Please, please don't do that. And the second question I thought was relevant. For some people, this is now on the other part of the spectrum. Some people have had blood pressure where they have side effects to everything, every medicine. What do they do? How can they control the blood pressure? Now, this can be quite a problem. It can cause a lot of anxiety, but there are ways around it. Usually, it's something that your family doctor or general practitioner can work on, or a specialist, the cardiologist. Now, some studies have shown that people who have this problem tend to have more anxiety, and they suffer with acid reflux. It's thought that this could increase their problems with tolerating their blood pressure medicines. It's a possibility. I'm not saying it's the case in every single circumstance. What the specialists tend to do or advise is really focus on lifestyle measures in the first instance. So you establish that the person has sustained blood pressure. It's not responding to medicines that they've used before. Establish that they've got high blood pressure, and then look, is there anything in the lifestyle, perhaps alcohol, perhaps weight? It might be to cut down a few pounds or kilograms. It might be to cut out, there might be some stress. There might be something going on, maybe at work or at home, that's contributing to the blood pressure not being controlled, and maybe that they can do without drugs simply by controlling stress or the weight or things like that. So they can look at lifestyle, they can look at the diet, they can look at cutting out smoking, cutting out caffeine, cutting out salt, things that can be done. If, despite the lifestyle measures, the blood pressure still remains high, there are still some things that we can do with the drugs. And one of them is something I mentioned earlier, is using smaller doses. So these people that did the studies found out that you can give people more than one blood pressure treatment, but using smaller doses, and actually found some benefits for quite a number of patients in using this method. So the point I'm trying to make is that even if there's somebody who they've tried everything and, oh, it's not, well, not that it's not worked, they just haven't tolerated it. Maybe they got a rash with this one, or that one made them dizzy, or that one made them vomit, and so they couldn't take it. When it gets to a point where 3 or 4 blood pressure tablets are having this kind of effect on the person, then it's time to sort of stop and look at things like the lifestyle, look at cutting down the dose of the medicines and trying them to see if they tolerate them better. And that's done in conjunction with a specialist. So just before we round up, I'm going to have a quick look at the chat. And hello, hello Tolu, nice to see you. Thank you for joining. Welcome, Philomena. Thank you so much for joining this afternoon. Glad to have you on board. Right, so I haven't got any questions, any other questions to tackle. So let's round up here. Thank you so much for joining. I hope it's been useful, the brief share about the side effects and what could happen, what to expect. It's a lot of information, and I just didn't want to spend too much time going over details. The really key takeaways are people who take the blood pressure medicines, be proactive. Don't be scared to ask, what do I expect? And on our part as clinicians, doctors, nurses, pharmacists, as we give these medicines, as we dispense them, to ensure that we're encouraging people to remember, if you have any side effects, come back and talk to us. So that's it for this session. Don't forget to like the video if you found it useful, and please share. I don't think you can subscribe while it's live, but you can come back to the channel to do so afterwards. But yeah, it's been really good to spend some time with you this afternoon. I do these live streams once a week on Sundays usually, so please make sure that if you've got a few minutes, I think we've gone past my 20-minute plan, so I'm sorry about that, but if you do have a few minutes next week, please do join me. So thank you so much once again. Take care. I will see you again soon.